Hi, everyone. A very good evening to Dr. Meinal Chaudhry. Dr. Meinal is a director with RadioDiagnosis, and she is the promoter of Aakash Healthcare. Dr. Meinal, it is a privilege to have you with us today on Need of the Hour, an initiative brought to everyone by CII-IWN. Thank you so much for being with us today.
Thank you so much, and warm greetings to all of you. We are here to, bring some cheer to the gloominess which is going on right now. So yeah, let's take the panic out of this pandemic.
Yes, and that is a wonderful, wonderful title, Dr. Meinal. Thank you everyone for tuning in today. So let's just dive right into it. While we wait for the audience to ask their questions, Dr. Meinal, I'm going to start by asking some of mine. So Dr. Meinal, let's take the panic out of the pandemic. There is so much chaos, so much panic right now everywhere. What is even like just the basic action plan for a layman today?
Yeah, so I think the basic action plan, the kind of prelim to anything is the mental balance, because we lose our rationality once we are imbalanced mentally. So first things first, keep your balance right. We are in crisis, but we will come out of it for sure. Be kind to others. We know that there are limited resources, but let's not do hoardings where it is not required. Seek professional help at the right time, and we all are capable to hold your hand and tide you through this crisis. So my appeal to everyone here is mentally be balanced, no hoarding of the resources which are already limited here.
Right.
So that's I think the take home point. Two or 3 points, which we can always have, our manifesto plan that we will not panic, we will not hoard, we will help each other. And I think we'll be through, and we'll seek professional help at the right time.
Yeah, I think that is very key. So, the only thing is, Dr. Meinal, resources are limited. So how does one not panic and stay calm in this moment? It's easy to say that, but resources are limited. So what do we do?
Yeah, so resources are limited, but let's look at the factual data. Resources are limited because we all are actually panicking. When we look at the factual data, only 2% of people who have COVID need hospital admissions. Only 1.5 go into the severe category, and less than that is the mortality happening right now. So if we know the data that out of 100, only 2 people need admission, we might or we might not be. Why can't we be in the 98% and not in those 2%? So why panic? 98% chances are there if you are young, if you don't have comorbidities, if you are fairly healthy, fit, you won't land up in a hospital. So I think just factually understanding this, we will come to a point where we know that resources are not that limited. Probably we are not making good use of them altogether. So yeah, so just be in touch with a healthcare provider. And most important is to have a knowledge and empowering knowledge, some tools which you can have sitting at your home, monitoring your health, monitoring the health of your loved ones, your kids. You should have this knowledge with you to tide this over. So there are fantastic tools available which you can use at home.
Can you tell us these tools that you're saying, the tools that are empowerment tools? So how do we understand really the progression of the disease for ourselves? That's the first thing. And what are the tools that can actually help us manage this at home? The tools of empowerment that you talk about, what would they be?
Yeah. So here we know, everyone now knows that we have 2 medical equipments which is the need of the hour of every household. One is thermometer and another is oximeter. We all have oximeters, but what a normal, humble oximeter can do for us, I'll give you a small example. So there is a test known as a 6-minute walk test. We all know that, so first of all, I'll tell you the progression of the disease. So this disease, COVID, basically has 2 phases. One phase is the replication phase. Replication phase means when the virus is multiplying, okay? So this replication phase is from 1st to 7th day when the virus is multiplying, but it is just giving you fever, just giving you cough, loose motions, conjunctivitis, things like that. But it is not killing you. The second phase is the inflammatory phase where it kind of puts in fluid at places where there should be no fluid. For example, lungs. Lungs are filled with fluid. So if lungs have to breathe, they have to be filled with air and not fluid. So we have to avoid the second phase, okay, where we are getting our lungs filled with fluid. So the key to address this problem is to get the understanding of the second phase faster, okay? Now, what happens when this killing phase or the inflammatory phase starts? Your oxygen starts to go down, which is typically after 6th to 7th day of symptom. In first 6 days, you will see oxygen is not dipping for normal, healthy, young adults. Mm-hmm. So we have to identify the inflammatory or the second phase of the disease faster. So what do? We put on our oximeter and check. It's 96 for me, it's 97 for me, all is hale and hearty, but your lungs might still be affected. So there is a very, very, very easy way to understand when your lungs are starting to get affected. And that's the time we kill the disease. We are able to, manage it much better than when the oxygen has started to go down.
What is that test?
It's called a 6-minute walk test. So what do you want me to explain it in a little detail?
Please, yeah. Could you elaborate? Yeah.
Yeah. So basically you take your oximeter and take your baseline reading. For example, for a healthy person, I'm saying it is 96 SpO2 while I'm sitting. And then what I'll do is I'll put my oximeter here close to my chest and walk briskly for 6 minutes. For people who are not able to walk briskly for 6 minutes, we tell them to walk for 3 minutes, okay? So typically when we do this kind of exercise, our oxygenation of our body should not go down. Even if it is going down, it should not go down beyond 5%. If it is going down beyond 5%, that means there is something wrong which has started to happen with our lungs. That means I, as a person, am more prone to get hypoxia. Hypoxia meaning that my oxygen will go down during the course of my disease. So if we start from day 2 and take the 6-minute walk test at home, every day we take 6-minute walk test, we are able to understand when my lungs are starting to get affected, even when my oxygen on oximeter is 97. That is the time we start killing. We start low dose steroids, we start, action against the disease, and we can kill it earlier than the normal progression of the disease when the hypoxia has already started. Right. I hope I am able to make my point clear.
Yes, you did. So at what stage, because you said that there is hypoxia, but what is the stage? What can you tell me, like as a reading, what would be that stage where we say, okay, 1 second, we really do need to go to a hospital now, or concentrate?
Yeah, so it is 5% drop of your baseline oxygenation. So if it is 98, if it drops by 4.5, and it goes to say 94, 93, that is the time that my lungs have started getting affected. I need to start some treatment. I have to be in touch with the healthcare provider. You don't have to look for beds, Abhi. No. Yeah. You just have to be in touch with your healthcare provider. My 6-minute test is positive. Help me now.
Right.
That's the way it is.
So just another question. So if it goes, you had mentioned to me that if it goes around, if hypoxia happens and it goes to around 88 or 90, so what is that threshold and what happens to the organs then if hypoxia?
Okay. Yeah, so our body organs, the viscera, we call visceral organs, for example, brain, liver, kidneys, eyes, orbit, all these are visceral organs. So these visceral organs can tolerate a hypoxia of up to 90 very well, right? Okay. So when our peripheral oxygenation, which is in our fingertips, this is the peripheral oxygenation. When we have peripheral oxygenation of up to 90, the viscera is still safe. when typically we say that at 94, 93, start looking for a hospital bed, start talking to your healthcare providers. But rest assured, your viscera is safe. Your organs, brain, everything will work fine until and unless you get a peripheral oxygenation of 90.
Okay.
Yeah.
Wonderful. So now I'm going to, we have 2 or 3 questions which have already come to me personally, which I'm just reading here, and then I'm going to start with.
Sure.
So, okay, now as an administrator as well, when should one start planning for hospitalization? I think you've covered. What to do at home when hospitals are not available? Can you just talk a little bit about that?
See, at home, see the moment, as I said, 6-minute walk test, if it is positive for me, I have a signal that I might land into hypoxia. So what would I do? I would start having a lot of water. Second, I will be extremely active because we know that this disease has clotting tendencies. Third, I will start arranging for oxygen at home. So if it is like 2 young adults who are affected, a concentrator will work absolutely fine. If there is some senior citizen, somebody who's high risk, somebody who's diabetic, please start arranging for a cylinder at home. So that is one, because even if you are not hypoxic at a particular time, 4 hours down, you might need an oxygen cylinder at home. So day one, I know I'm going to go land into hypoxia. These are the 3 things we should do. We should learn the art of proning. We should also learn how to attach the assembly of oxygen cylinder so that at the time of panic, there are a lot of panic calls coming to us. We are not able to join the flow meter to, is it up or is it down? What to look, flow meter or regulator, where to look? All of that in a balanced mind, just learn it. This is the preparedness you should do. Once you know that your 6-minute walk test is positive, you might need, a help with your oxygenation. These are the 5-6 things we should do at home and be prepared. No panicking, you will tide through it and just get in touch with the healthcare provider.
I think one key takeaway also here is, in addition to everything you're saying, is do the preparation at the start. So yeah, with these oxygen cylinders, oxygen concentrators, rather than adding to the panic at that point, just prepare. How do you use them? What do we do? All of that. So, and you also touched upon a diabetic. Can you just share how this is impacting diabetes, what is happening, and
So for all the diabetic population out there, I just want to say 2 key things. First, for another 3 to 4 months, just cut out sugar and high glycemic food from your diet. Bring your HbA1c to fairly good level. 5.5 is a fairly good level. Bring it there. It cuts the risk of getting complications of COVID immensely if your sugars are controlled. So diabetes per se is a fairly okayish risk factor, but uncontrolled diabetes is a heavier risk factor. Hypertension, okayish risk factor. Uncontrolled hypertension it weighs a lot more when the where risk factors are concerned. So even if you're diabetic, don't lose hope. Just pull down your sugars and keep it to a HbA1c level of 5.5. Other than that, what is happening these days? Stress has caused a lot of diabetic people. Their sugars are coming raised alarmingly. Please don't go there. Please don't go there. It's going to, add to the problem. So mental balance, sugar control, HbA1c level less than 5.5 cuts down a lot of risk from our diabetic population. So I think that is what we can do before getting COVID. Of course, after getting COVID, the management stays the same. That you have to have steroids. Steroids will increase sugar level. But then you have the sliding scale available on net. You can use insulin to bring down your sugars, and you'll be just fine when you are out of,
Dr. Meinal, you also mentioned hydration. You said that one of the things one can do. So can you talk about that, and what is the right quantity of hydration? Because everybody says hydrate, but what is right,
Right. So these days we are hearing that remdesivir is the Ramban, is the magic pill. I just want to cut it out. The magic potion available with us right now is water. So 5 liters of water, if you don't have any kidney condition, if you don't have any heart condition, 5 liters of water per day is the magic portion. Also, even if you have an exposure to virus, what does virus do? It brings out toxins in our body. Water is the thing which washes out, flushes out the toxins. So 5 liters of water is the magic portion, not remdesivir.
Interesting. So 5 liters, and it's very good to help flush this out.
Yeah.
Okay, wonderful. We've got a question regarding the CT scan, at the stage of the CT scan. So can you tell us the importance of the right date of a CT scan?
Yeah. So, for COVID, we have to know how the disease is progressing and what day of the disease are we sitting. As I said, first 7 days will not do anything. They will just give you fever and all. But what is scary and what is, where you have to be cautious is from 7th day to 14th day. In fact, 7th to 12th day. So CT scan done before 7th day doesn't give us the correct picture. CT scores on 6th to 7th day might change the management protocol for a lot of people. So get a CT scan done only when prescribed. And if you want to, first of all, don't use CT scan empirically, as a lot of talk of the town is going that it is equal to 300 X-rays. It brings up your cancer risk. That is true. You should not use CT scan as a toy, as a, on your whims and fancies, let's get CT done. No. Do it on prescription around 6th to 7th day. It helps in changing the management protocol if you don't get hypoxic earlier. So if you get hypoxic, as in the oxygen is falling down earlier than 7th day, then your healthcare provider might prescribe you. Otherwise, CT scan has to be done on 6th to 7th day, not before that at all. And okay. Yes, it changes our management. So based on the score, whether we have to start steroid, whether this person will land up in critical hypoxia, whether this patient will need admission, all of that will depend on the 7th day CT score, not before.
Okay, wonderful. So it's really important, everyone, as a takeaway, that the date you do it is really important, and it can impact the management of COVID, right? One last question before I start taking more and more from this audience member here, from this group here. Concentrators, how do we identify a good one, and should everyone buy one and keep it at home? If saturation is improving after using concentrators, what does that mean? Am I getting better, or is it just the machine support? Can you answer that, please?
Yeah, so there are guidelines on concentrators available around the net. Just go through them and, use the medical journals. Use the guidelines available in the medical journals. I can give you 2 key points which you keep in your mind and which will help you. So buy the heaviest machine. The machine which is light, portable, will just give you very, very impure oxygen. So what concentrators do, environment has 21% oxygen. They concentrate the oxygen and give it to you. All the machines which are portable ones, lighter ones, 5 to 10 kgs, even up to 15 kgs, they give you a very impure kind of oxygen. And for example, a 5 liter oxygen concentrator, a lighter one, will give you say 90% oxygen at 1 liter, but it will fall down to 70% at 2 liter, further fall down to 45 to 50% at 3 liter, and at 5 liters, it is practically air. So if you have not yet bought a concentrator, buy a heavier compressor one, more than 25 kgs. Buy a 10 liter one, which can at least give you 90%. And it also says that how much percentage purity will it give you. Buy a concentrator which says more than 90% purity. So a 10 liter concentrator, heavy duty one, will give you around 94-95% purity of oxygen at around 7-8 liters. So that is how, just go through the manual. These are the 2 things: heavyweight compressor and more than 90% purity at 10 liters. So these are the 2 guidelines you can broadly follow, but otherwise there are a lot of guidelines which are available in the medical journals. Just go through them and you'll understand a bit more about it.
I think the two that you have mentioned are both very important, and I think that's a great takeaway for our audience.
Yeah.
Okay, now coming to all the audience questions. Thanks, Dr. Meinal. Could you please let us know about the not so common symptoms of COVID, such as conjunctivitis a symptom?
Yeah. So in the second wave, we are also seeing little uncommon symptoms. Tummy problems, loosies, as well as crampy pain is very common. We are also seeing conjunctivitis besides anosmia, which is loss of smell, loss of taste, cough, which we all know, fever, runny nose. So besides that, fairly loose motions, abdominal pain, and conjunctivitis is what is coming. Okay. In addition to, because it inflames all the mucosa. So when it inflames the mucosa of throat, it gives us throat pain. Eye mucosa, conjunctivitis. Bowel mucosa, loose motions, tummy issues. Lung mucosa, cough, respiratory issues, breathlessness. So that's how this virus is working. It is targeting the mucosal cells.
Okay, very interesting. Thank you for that. That's very, very good information. Now, Sonil's got a question. We just measure on index finger of right hand with oximeter post the 6-minute walk. Is that correct?
Can you come again? We have to measure. Yeah. So if you want to measure the correct oxygenation, it typically has to be the middle finger of any hand. They say left. That is the standard way to do it. Middle finger of left hand. The way to do it is that your fingertip should cover the red light entirely. And you have to read the reading after 45 seconds of contact. You will not read the reading just, I put my finger in the concentrator, it showed me 94 and 94. No. Contact your finger for good 45 seconds. Be there with the oxygenator, with the oximeter, and read the reading after 45 minutes of good contact. That is the true reading.
Okay. Thank you. Then Pooja is asking 90 oxygen after 6-minute walk test or before?
After 6-minute walk test. You're saying when is the walk test positive for you? Yes. If your oxygen falls down from your baseline oxygen level of more than 5%, we can take it 5 also, So I was say 99 and I came to 94 after walking. It is a positive walk test for me.
Okay.
It is showing that there can be some bit of lung involvement which has started, and I should start preparing that my disease can lead me to hypoxia.
Okay. So related to this very question, we've got Captain Ashok saying, is it enough if one has satisfactory oxygen level, say about 95%, and one passes the 6-minute test regularly? Yes, okay. Then we've got Glossy asking, oxygen concentrator or cylinder, which is better at home?
As I said, if we have young people at home, low-risk people at home, concentrator with heavy compressor with 10-liter capacity is good to go. If we have senior citizens at home, please arrange for a jumbo oxygen cylinder at home so that you can buy time. You can give them comfort when they really need it, when we are looking for beds in it. At least in Delhi, the situation is such. So if senior citizen, try and arrange a cylinder. For youngsters, low-risk people, heavy duty concentrator will work. Will tide you over the 14 days.
Also from Ashok, we've got, what does excessive dryness of throat indicate?
Excessive dryness, yes, this happens in virus. So basically, it is causing mucosal irritation. It is doing that mucosal thing, what the virus has to do. It doesn't indicate as such anything, but it's a symptom of COVID or any other flu as well for that matter. So it doesn't indicate any severity or any mildness or anything. If that is your question, if I answered that, it doesn't indicate any severity. It is a symptom.
It's a symptom. Okay, thank you. Rinky's asking, so does everyone need to take steroids? So is it almost avoidable? Can you get away from COVID without taking steroids? And the part of this is ICU at home a viable option?
Okay, so steroids, as I said, so what is the role of steroids? Steroids basically calm down the inflammation which is happening in the body. So as I said, After the 7th day, what is killing us is not the virus. What is killing us is the inflammation which is happening in our body. So, if that inflammation is leading to a lot of lung complication where we are not able to breathe or where we are not able to, take oxygen in our body, we have to kill that inflammation. And what can kill it? Steroids. So, it is not that everyone needs steroids. Steroids would be needed by people who are having a hypoxic COVID. Not all COVIDs are hypoxic. People can go through tide over COVID without getting hypoxia very well. So I'm saying steroids will only help when you have hypoxic COVID or a certain level of CT score on day 7. Not everyone needs steroid. Don't start it on your own. Ask a doctor and then start steroid.
Okay.
Have I answered the question?
I think you have.
Yeah.
So the other question from Ashok is water or ORS? What is better?
Water.
Okay. From Tanya, first day is when your symptoms start or you get your report?
When your symptoms start. Report you can even not get done. So once your symptoms start, just isolate yourself. 99% COVID is in the air, 99% it is COVID. Isolate yourself. That's your day 1. Report positivity you can, have any time between 14 days. So when first day is once when your symptoms start, very important point, don't wait for the report. Isolate yourself, break the chain within your family. Even if you have slightest of symptom, isolate yourself.
Okay. Is headache also a symptom?
Yes, headache is a symptom, but normal migraine headache, it is not like that. The headache of this virus is like a irremediable kind of a headache. So yeah, if you're having headache along with some other like a runny nose or something, of course, then it is COVID. But headache you can also get by the stress which this virus is causing now. So you can't be isolating yourself at every headache you have, because that is practically every other day we are getting these headaches.
That is true. That is true. Okay, please explain the role of plasma. Does it help and when should it be given from Rinki?
Yeah. So plasma basically helps very early on in the disease. There are various studies which have shown that there is a slight role of plasma, but only in the moderate disease and very earlier on. So once the hypoxia is set in, once a patient is in ICU or, on a very high flow oxygen, a lot of studies have shown us that plasma has practically no role. And in our hospitals, we have limited the use of plasma to a lot of degree. We are just using them in a very, very small percentage of cases who have moderate disease and land up in hospital earlier in the course. So,
okay, so its effectiveness is really at the start. If you get it in any fashion, you have moderate disease, and that is the real time for it to be able to make an impact.
Once it is severe, no role.
Okay. Do you need to mask up at home? And that's from Rocks.
Mask up at home.
Yes.
Masking at home, say if you have healthcare providers at home who are going to the hospitals and rest of the people who are elderly, if they are sitting with them, talking with them, I feel it's a fairly good idea to mask if you have healthcare providers at home. But otherwise, if everyone at home is following the basic COVID behavior, appropriate COVID behavior, I don't think it's a good idea to mask yourself at home. But everyone should uncompromisably use COVID appropriate behavior, which is masking when you are stepping out, hand sanitization, and social distancing. Another one which is coming is proper ventilation at home, because Lancet has now proved that this virus is airborne as well. So proper ventilation at home is necessary. Rebreathing all the time, 24 hours, rebreathing inside the mask is not healthy.
Yeah, that's absolutely true. So just to add on to this question, she's asking, walk in your garden away from others with the mask. Is that required, or you can just be open without a mask in the garden?
See, if it is your personal garden, of course, you don't need to. But if you are using a public garden, of course, you should be masked up. You never know whoever crosses and just gives a sneeze, you would be exposed big time. If you're going to a public area, please be masked. That's your safety.
Okay. From Divya, we've got, what are the long-term effects of COVID that one should try and prevent?
Try and prevent?
Yes.
Sorry, long-term effects?
Impact. Yeah. So what are the long-term effects or impact of COVID that one should try and prevent? Are there any long-term effects of COVID that, I guess we know
so I think this would be, what are the long-term effects of COVID once a person has got COVID, is it?
Yeah, right.
So we won't be able to prevent anything, because once you've got COVID, you've got COVID. See, there are a lot of rehab programs which have come in, which help you increase your lung capacity after once you've gotten infected with COVID. There are a lot of mental health issues also which start cropping up, because a few things which you would do at ease, you are not able to do with that much of ease once you have recovered after COVID. So you have to enroll yourself in those, and it gives some bit of depression to a lot of people. There's something called brain fog, which happens. So pretty much there are cases which have led to renal problems also after COVID. So in pregnant women, there are placentation abnormalities also. So there are, long-term effects of COVID which are coming up. But of course, long-term effects with rehab, we will be able to counter them to a great extent. So to each its own, where you have an effect, there is a rehab available for that.
Okay, thank you so much. And we are running out of time. Actually, we've exceeded our time, but if we can take 2 more questions, it'll be really good. Is that okay with you, Dr. Meinal?
Sure, definitely.
Okay, so from Mrs. Sushil Agarwal, we've got, what supplement for lung health as breathing is a problem?
Incentive spirometry, no supplement. Do the physical exercise. It's called incentive spirometry. It's like a tube with a ball. You have to blow inside that and pull up the balls. So that is one physiotherapy which will increase the lung capacity. No supplements as such.
Okay, wonderful. From Ashok, does exposing a COVID patient to morning sun for some time help her in any way?
Yes, it will give them mental strength.
Okay. Then please explain the correlation between COVID and heart attack.
Yeah, so basically what COVID does is it affects the microvasculature of the body. So what is microvascular? Is the tiny vessels which supply the muscles of the heart, which supply the muscles of the brain, which supplies the cells of the lungs. So COVID actually targets these microvasculature. So the blood supply to various organs, for example, kidney, lung, brain, all of this is affected once they are infected with COVID. So when the vasculature of heart is affected with COVID, it gets a little weak. It gives you myocarditis, which we call it inflammation of the heart muscle, and it leads to heart attack. There are other hypotheses also why heart attacks happen in COVID, but this is the simplest I can tell you if you are a non-medical professional. I mean, if you are a non-medical person.
Okay, thank you. So there is another one. Does COVID affect eyesight as well?
It doesn't affect the sight per se, but it gives you conjunctivitis, irritation, watering, and some bit of blurring of vision during that acute attack. But no, I haven't heard anything affecting the vision, the sight. No.
Right. Okay. What does airborne mean in the actual sense? If you're sitting on a balcony, what does airborne mean? What's the safe distance?
Okay. So basically, initially the hypothesis was that virus sits on these droplets. When we sneeze, we have more than 4 micron droplets where the virus sits. And since these droplets are heavy, this will kind of settle down and the air will be clear. But Lancet has proven that virus on its own sits on the dust particles, which are lesser than 4 micron in size and can even float in air for some time. So airborne means that even if you are careful about fomites, about droplets, about everything, you can still catch COVID if there is a COVID patient who was there for some time and the virus is there in air for some time. So ventilation is one of the best way to flow that air, to flow, to, kind of agitate that air away from you. In a stagnant environment, the concentration of virus will be very high. So, the chances of getting an airborne infection is very, very high in the stagnant area. Sitting in the balcony, it goes very low because air is typically moving. If you ventilate your homes, the chances of getting any airborne infection goes very low. So that is what airborne means.
I think another thing that you just mentioned, which is very, very valuable, is that typically it used to fall, but now it's sitting on dust particles. So airborne still means that without proper ventilation, even, I mean, that's still going to sit in the air, right?
So ventilation is very important aspect which has come up for prevention of COVID infection after these studies have come up. There was a hypothesis earlier also. It is not that virus has mutated and now become airborne. There was a hypothesis earlier also, but now we have evidence behind this hypothesis. So we know that it can be airborne as well. So ventilation, which is the easiest thing we can do.
Yeah, thank you. So is FabiFlu required for all COVID patients? That's from Daljit.
No.
Okay.
We are over prescribing FabiFlu.
Okay. From Reena, if there is a case in your apartment, can the lift be infected?
Yeah, lift. So if you don't know who passed through that lift before you came inside, if somebody sneezed on that lift, there are virus particles. So the best thing is no touch technique. You go there with your masks on, just, touch it with a COVID key or toothpick, as a lot of people are using. And even if you touch it with your hands, see, one thing I want to make that thing very clear here. Even if the virus is there on my hands, it will only affect me if I put these hands on mucosa. So if I'm not putting my hands on my face, even if the virus is there on my hands, it's not going to affect me. So even if you go out, you use the lift, you do vegetable shopping, grocery shopping, one good thing if we all can inculcate in ourselves is don't touch your hands on your face.
Yeah.
Once you're home, wash your hands, sanitize them, do whatever itching and all you get it. Just stop touching your face. You'll be virus free.
Okay, wonderful. Thank you. Is it okay to, this is from Sush, is it okay to walk in our own balcony without a mask? I think so. Yes. Okay. From Deepika, once you are tested positive, after how many days is it best to get a second test done?
Second test is not required. After 14 days, you can break your quarantine. The evidence has shown us that after 10 days of symptoms, the virus infectivity goes very, very low. And after 14 days, it is practically non-infectious. So you don't really have to get yourself tested again, unless your unless your company wants that. And in that case, if your CT value is above 30 or 32, you are a non-infected case, you can join your work back. But no need to get yourself retested. 14 days quarantine is good enough.
Yeah, okay. Please, then this is from Abhishek. Please ask about preventative question also for supplements. I missed the beginning in case you can't.
Yeah, so supplements, see, if we are having a good balanced diet, I don't think supplements are really required. But if you anyways want to have supplements, it's going to give you general immunity, but not immunity against the virus. So supplements, you can have vitamin D, zinc, multivitamins, but don't take it to prevent yourself from virus. Just take it for your own good health if you're not able to, cover all those minerals and vitamins in your food. So supplements practically doesn't make you immune to virus.
Okay, so we've got a lot more questions. May I continue? Okay, but now we are going to stop after the last 8. Sure. Next 8, we're done. Okay, guys, because we have to close this. How much does sanitation of streets help with COVID? This is from Nipika.
Sanitation of streets maybe will help with some bit of droplet infection, but what works is what we all know: social distancing, masks, hand hygiene, ventilation.
Okay.
And no touching your face. Please teach all your children, don't touch your face. Use tissues. Yeah.
Yeah, children, staff, everyone.
Correct.
Vedant, we've got, in case of ventilation, will air purifiers help?
Why don't we just open the window and ventilate? Why why don't go towards an artificial way? Air purifiers typically, take out very, very small particles, but they don't take a long time to be very, very functional. So, if there's a large space, it sometimes takes 2 to 3 to 4 hours for that place to be sanitized by an air purifier.
Right.
The best thing to do is just open your windows, let air flow in and close them once you are, just change twice a day in your house. I think you're good to go.
Okay. Now we've got from Mr. Sushil. Again, I am 16 days past. My doctor still insists I must take FabiFlu for another 10 days. What do I do?
I'm 16 days past COVID.
Yeah, I'm 16 days past. Let's say that the point of origin must have been 16 days ago. But my doctor still insists I must take FabiFlu for another 10 days. What should I do?
See, if you've got only COVID and no other super added virus infection or something, I don't think that you should continue with FabiFlu. But again, I don't know personally why they have prescribed you this.
Yeah.
They might be having some good logical reason. So please ask them that, is it for COVID or is it for something else, what they're thinking you might be going through. I don't think after 16.
He has comorbidities, right? He may have comorbidities. So it's very
difficult. So it will be a very, very personal use case. I won't be able to comment it here.
Yeah. Okay. From Tina, we've got, if someone has very mild symptoms, do they start taking ivermectin?
No. Not needed.
Not needed. Okay. Thank you so much. It's been a wonderful, wonderful session with you, and we really appreciate you coming on our platform and spending a time and actually taking the real questions from our audience on our show, Need of the Hour. Thank you so very much.
Thank you so much, Bhavna. I hope if I'm able to take out an iota of panic out, I think my goal would be achieved. And it was really a stress buster session for me coming on board. And thank you so much for having me over. Thank you.
No, it's been a pleasure. It's been a privilege and a pleasure to host you. And you have actually done something which is, you've put a lot of people's minds at ease. And so, our endeavor of taking the panic out of the pandemic a little bit has been fruitful. Really appreciate
Thank you. Thank you so much for that.
Yeah.
Thank you.
And for everyone, please do join us Monday to Friday. We go live on both CII on our Zoom platform as well as on Facebook. We have thought leaders, experts, and doctors coming on the platform, giving you credible information, answering your questions, and do join us Monday to Friday. Thank you very much. And tomorrow we have with us Dr. Meenakshi Ahuja, who's going to focus on women health. So what is the impact of COVID on the fairer gender? So
Great.
thank you very much for joining us. Thanks very much.
Thank you so much. Stay safe and stay cooped up. Bye.
Thank you.